Thank you all so much for being here today. It means a lot to us. It really, really does. I'm Juliana Lukasic. I'm the Senior Director of Public Affairs for Central City Concern. That puts me in charge of fundraising, communications, branding, and public affairs. Solving homelessness is everyone's business. We all need to be invested in solving this crisis. Today, we're going to dive into solutions at play in our community with some stakeholders in the field. What prompted us to pull this panel together was the one-day documentary led by Kyle Iboshi and his team at KGW. Kyle and his team had a chance to feature 14 unique perspectives for over 24 hours around the city to take a look at this problem. So I'm going to introduce the members, and I have one here from Dr. Mendenhall, but guess what? We're a little bit behind schedule, and we already met Dr. Mendenhall, so I'm going to make a command decision and move on to our other panelists, starting with Laura Brown. Hello, Laura. I know Laura well from the work I do. I'm so excited she's here. Laura Brown is business manager for Clean Start. Laura's worked for CCC for over 12 years, most recently as the business manager of our Clean Start program, where she began her career as a trainee. Clean Start is a 6-month homeless to work training program that's trained thousands of folks over the years. Many of you have seen folks downtown and here on the east side pushing the barrels, riding in specialized bikes, or driving Clean Start trucks. After many years of addiction and homelessness, Laura was given an opportunity to change her life. Laura went from homeless to homeowner and has almost 14 years in recovery. Laura is passionate about giving others the same opportunity to succeed that was given to her. As she says, this job is about changing lives. We just have to pick up the trash along the way. Hello, welcome.
Thank you.
Hello, Kyle. Kyle Iboshi is an award-winning investigative news reporter with KGW. Since joining KGW in 2000, Kyle has covered a variety of local, national, and international stories, including the aftermath of the 2004 tsunami in Sri Lanka, 9/11, and the Winter Olympics in Vancouver, Canada. Kyle has also traveled and reported extensively on U.S.-Korean relations, U.S.-Japanese relations, and received an Emmy Award for a special report on the Japanese tsunami debris. In 2017, he was also selected for the prestigious Kiplinger Fellowship. In April of this year, Kyle led a team of KGW journalists who set out to document Portland's street-level response to our homeless crisis. The result was a documentary, One Day, that tells 14 unique stories from all sides of the homeless crisis over a single day. If you look in your program, you'll see a QR code to that video, and I recommend that you watch it, not right now. Don't be distracted, but do watch that video when you have a chance. This is the power of media. I recently got a notice from KGW that that video had been seen by 1 million people. 1 million people have seen his documentary. That's really impressive. All right, so welcome, Kyle.
Thank you.
And last but certainly not least, Eric Hunter, President and Chief Executive Officer for CareOregon. With more than 25 years of leadership experience in the healthcare field, Eric brings a deep knowledge of Medicaid policy, Medicare plan administration, commercial plans, and the integration of physical and behavioral health. As CEO of Oregon's largest provider of Oregon Health Plan services, Eric has worked tirelessly to improve individual and community health. Prior to joining CareOregon in 2016, he served as Chief Operating Officer for Boston Medical Center, Health Net Plan, and a variety of executive care roles. Welcome, Eric. I'd like to ask you all this question. I want you to touch briefly on how homelessness impacts you or the organization you represent. Andy, let's start with you.
Homelessness is our reason to be as an organization. It's been our history of serving the most vulnerable, but also the most resilient folks in our community. And we have a 42-year history of doing this exceptional work. And as I said in an inarticulate way before, our mission is our people are our mission. That's at the core of who we are as an organization.
Thank you. You're usually very articulate, so we'll give you a break on that one. Laura, tell us a little bit about how it's affected you.
Well, managing a homeless to work program, a lot of times we see people come in and they're still living in a tent. Sometimes they don't even have a tent. And so we keep tents on hand with sleeping bags for them and help them navigate getting on a housing list. Sometimes that can be difficult, and help them through that. So.
Thank you. Kyle, impacts of homelessness on the organization you represent.
I would say homelessness is, if not the most dominant, one of the most dominant issues that we cover at KGW. I'm proud of the fact that KGW, roughly 5 or 6 years ago, dedicated a reporter to covering this beat. That's exclusively what they do. Her name is Blair Best, and she's wonderful. Before that, Maggie Vespa covered the beat. But we've invested in the idea that we need to cover this in a thoughtful way. It's obviously a very complex, nuanced issue, and so a 30-second story on it doesn't do it justice. And that's why we dedicate nightly coverage to this issue, in addition to some of the special projects, such as the one-day documentary.
Great. Eric, how about you? Tell us about CareOregon and the connection.
Yeah, 2 minutes to talk about how homelessness affects CareOregon. I'll try to be succinct on that, in that for 30 years now, our responsibility and our mission has been to serve the most vulnerable in our populations, right? Across the state. We have members, almost 500,000 of them in the Metro, North Coast, Southern Oregon. And when we deal with their entire needs, their whole person needs, it starts with the ability to have a home. Everything else comes from that. It's a basic human right. It's a necessity for anything that we want to do to help them live their best lives. So the more that folks are left out there to their own devices, particularly on days like today, for us, smoke is an inconvenience. For asthmatics and people with COPD, it's life-threatening. They can't just turn on the AC. They can't just close their doors. So every day, those folks need us, and every time someone is on the streets who doesn't need to be there and no one needs to be there, it impacts their whole person health, and our job is to make them healthy and happy, and we can't do that if they're homeless.
And Eric, just for the folks out there, how does CareOregon interact with the homeless population? What is your role, CareOregon, in the continuum?
Yeah, it's multifaceted. There are people that we deal with directly through our care management and case management efforts, but a lot of the work we do is with partners like Central City Concern. And with our provider partners like Kaiser Permanente and OHSU Health, to identify folks who are in need, who understand sort of what their issues are, how we can address them. So we try to facilitate, we try to coordinate efforts, but there are some direct interactions we take, but really we rely on partners and enabling them, giving them the tools, resources, the data, as Andy talked about, so we can identify the right people, understand the right interactions and engagements, and take action on them.
Thank you. Thank you. Kyle, if you asked everyone in this room, I think we'd have 300 different opinions about who's living on the streets. How do you think media can help to bust myths about what the reality is out there?
I think understanding is an important part of it. The beauty of the one-day documentary, which if you haven't seen it, I'd encourage you to watch it, is that we were able to go in tents and encampments, in RVs, and meet people and share their stories. One of the really cool things about television news, which I've been doing for a long time, is that we're able to take people to places they normally wouldn't go, and you're able to interact, or at least feel like you're interacting with people you normally wouldn't have exposure to. And so we're taking people from their living rooms or their offices or wherever they may be watching, and however they're watching, on their device or whatever it may be. And we're taking them into that environment to help them understand that these are real people and that the challenges they're facing are truly complex, and every story is different. It was interesting after doing this documentary to hear the feedback from the community that watched it. And a lot of people really were touched by the fact that, so often I drive by an encampment or I drive by someone who's struggling with a crisis, and I don't think about it. I don't think about that person as a human being. I just think of it as an annoyance, a nuisance, that type of thing. But when they spoke to us through voicemails and social media, et cetera, a lot of people said, you know what, this is the first time I actually saw these as people. And I started to understand their struggle. And so I think the role that we can play in the media is helping to tell those individual stories to help the community better understand.
Thank you, Kyle. So, Laura, in your experience, can you tell us what would have or did help you the most?
I think looking back at my time in addiction and homelessness, for many years, I was more of a shadow. Like, people never really looked at me. People never asked me what I needed, what would help me the most. I was in and out of incarceration and was never even offered anything. It was just in and out and back doing what I kept doing. I think being able to be offered services, that would have helped me. That would have helped me more than anything. Just to know somebody was looking at me and actually see me as a human being, not just a number. That would have helped me the most. 'Cause I didn't grow up with any positive role models. I didn't have anybody. My mother did the best she could. But unfortunately, I didn't have a positive role model. So for somebody to actually see me and offer me help, that would have helped.
Laura, thank you so much for sharing that. Her courage, I don't want to embarrass her, but her courage never ceases to amaze me, that she's willing to talk about her story. Thank you, Laura.
It's for
I really appreciate that, as does the rest of the audience. Eric, how does access to or lack of access to healthcare perpetuate homelessness? Is there a business case to be made for ending homelessness?
Oh, without a doubt, without a doubt. I think that, as Laura mentioned, a lot of the issues that we end up dealing with down the road are because no one took the initiative to reach out to folks and understand what they need. Not what do we think they need, not what we think they deserve, but what they believe they need to change their situation and to grow in life. We know for a fact that when someone is living on the street, someone's homeless, we talk about, Andy talked about them aging, it's an aging population. Just that fact alone adds 20 to 30 years of biological age to their body. So someone who's 40 years old, chronologically, has a lot of the inner workings of a 70-year-old and the issues that come with healthcare related to that. We know that people who are homeless that get discharged from a hospital with a wound, they won't heal as fast because they don't have a safe, clean space. They don't have the right foods. We know that diabetics who don't have a refrigerator to keep their insulin in aren't going to stay. So there is definitely a business case, and there's a humanity case more than that, but the business case hopefully gives us the ammunition we need so that our elected leaders, like the ones we're lucky enough to have join us here, can make the case to those who don't seem to care as much that these investments are critical in saving our communities.
Thank you. That's really important statement. Andy, let's talk a little bit about CCC model. I often think everybody knows everything about Central City Concern, only to be informed that folks only know a part of what we do. And I think it's really important to share with everybody, can you talk about the CCC model and what we know works?
Yes, absolutely, Juliana. We like to say that CCC is a connected community of care. And what we know that works best is getting folks inside. Shelter is a step, but shelter is not a set of house keys. Giving people a sense of their own space, agency and autonomy and safety of their own space, and then wrapped in a community of folks with lived experience, with professional expertise, and access to health services, housing case management, employment services when the time comes. That's the magic. That's the magic that drives outcomes. And at the core, it's acknowledging the humanity of the individual, giving them an opportunity to be connected in community, and have an opportunity to change under their own agency, supported and loved by community experts around them.
Excellent. Now, that is a really, really great overview. Let's talk about the day-to-day. What does CCC do?
CCC does day-to-day provide housing services to close to 3,500 people. operates residential treatment, detox from substance use, outreach to folks that are under a tree or in a tent that need to take their psychiatric medication, helps folks find a job, helps clean the city and make our city more livable. Most importantly, we are a community of folks that are driving connection and helping people feel like they deserve the opportunity to change.
I'm going to pick on Andy even a little bit more here. And yet, the problem seems to be growing. We're here. We've been here for a long time. What can we do together to scale, to bring solutions to scale?
So first, we need to know how big are these issues. We need to bring data sets from the Joint Office of Homeless Services as well as from our insurance partners together, and we need to look at that together as a team. We need to bring the business community, the insurance community, the housing community, government, and service providers together to say, this is how many folks have a need. We need to grow over time to close this gap. And ultimately, that's what we need to do. And the lack of that data transparency is part of what's gotten us this far behind.
All right, thank you. Now I'm going to pick on Kyle for a moment. You know, media plays a big part in what we experience on a day-to-day basis when we think about what's happening in our community. You know, media plays a huge role in elections. It plays a huge role in perceptions. It plays a huge role in education. My question to you, Kyle, is how can media help people understand the real solutions?
I think in large part through thoughtful reporting. I think you know, one of the fundamentals of journalism is to look at what's working and what's not working, and to highlight what is working, and then secondarily to question the policies, programs, systems that are not working and call those out. As part of this as well, exploring what is working elsewhere, and seeing what we can bring to our community that may bring about change. I'll also say highlighting the success really is valuable. And I think back to this one-day documentary and a few of the people that we profiled in this documentary, including a woman named Tiana who was living in an RV with her young daughter. And really a remarkable story, but after the documentary was done, we went ahead and followed up with Tiana. And she got into housing. And to be able to tell that story about the struggles that she dealt with and why she was here in the first place, and then how she ended up in temporary housing was really powerful. And it showed the systems that worked. And I think if we can drive that home to the community to help them understand there are solutions, there are success stories, that gives people hope. And I think a lot of people are looking for that right now.
I agree. Thank you. Thank you. Laura, there seems to be a lot of myths, we've talked about that today, out there that homelessness is an individual problem. Do you agree or disagree with that statement? And if so, why or why not?
I can only speak for myself. And I was the problem for myself. I was the individual problem for myself. I kept doing the same thing over and over again until I was held accountable for my actions. And when I was held accountable for my actions, and I was finally given the option, somebody else made the choice for me when I was held accountable. Either I go to prison or I go to treatment. And that's what I needed, to be given an option to finally say enough is enough. And I went to treatment. And I have almost 14 years clean because of it. But there's more to that. I went to a treatment center that did not offer help with housing and employment. I stumbled upon Central City Concern. I had never heard of Central City Concern before. Somebody else was going to go get a job at Central City Concern, and I thought, if she can do it, I know I can, right? But it wasn't that easy. I didn't just walk in there and get a job. I had to do something to get the job. I had to do a program, and I had to go there for 6 months. And I had to go and apply for other jobs, and I didn't get those jobs, and it hurt my feelings because I had a criminal background, and people turned me away. And I couldn't even get it. You know, Pizza Hut call center wouldn't even hire me. That hurt. And it took me a long time to get the job where I work now. I got the job as a janitor trainee in a 6-month homeless to work program. And I didn't even think I was worthy of that. And today, I lead that program. And I'm glad Pizza Hut call center didn't hire me.
Laura, thank you. You really have personified the meet people where they're at and help themselves in this journey of recovery. And both you and Rev in the video that we watched, you know, they worked hard to recover. And we met them where they were at and helped them along that journey. But ultimately, it was Laura who helped herself to be where she is today, and now she's a homeowner. I'm just so impressed. Thank you, Laura. Thank you. So, Eric, can you talk a little bit about the data health system has access to and how it can contribute to solving this problem?
You know, we have a good deal of data in the health system, but it's not everything, right? And it's scattered. It's all over the place. Different organizations have access to different parts of it. We don't necessarily have agreement on what things mean, so you can't match them up. There are even federal regulations about what you can share and what you can't, particularly around substance use disorder services. But what we are doing is, with the leadership of folks like Andy and our folks at HealthShare, saying, how do we at least take what we have, right, to slice it and dice it and dig into it and say, how is there actionable information contained within this data set? You know, how do we go from a world in which we want everything to be perfect and we need every I dotted, every T crossed before we do anything, but do something with what you have right now. I mean, I say all the time, the first step to doing anything is doing something, right? And so what we're doing is we're saying, let's take the data we have and then continue to work on getting more of it, getting it fleshed out, getting it shared, getting those elements, particularly around race and ethnicity and gender, proper gender assignment, geography, and those other social and demographic issues into the set, so we can then slice and dice and make sure we're doing the work on an equitable basis. But we've got to have that data, and we've got to continue to have people come to the table and say, you know, let's see what we have, let's find something to start with, and let's move from there.
Andy, how is that data going to help us end homelessness?
When we have that data set, imperfect as it might be, for the first time, we're going to really understand the size and the scope and the scale of some key diagnosis drivers or diagnostic drivers of houselessness. And those are things like substance use disorder, specifically opioid and stimulant use disorder. Things like severe mental illness, think schizophrenia, and untreated schizophrenia out in our community. When we can really look and see what healthy engagement with healthcare and other services looks like, which you can do through claims, and what unhealthy utilization looks like. And I like to say unhealthy utilization is paying for the complications of untreated illness or paying for the complications of untreated houselessness. Yes. Right. We're then going to have the opportunity to say, this is how big the issue is. And this is the size and scale that we need to close those gaps. And most importantly, we're going to really understand not just the human cost, we see the human cost every day, but the fiscal cost. And ideally, those dollars, thanks to this new waiver, can be redirected in a way that will hopefully create more sustainable pathways for more folks over time.
Oh, okay, thank you. I want to talk about something that is really, really critical for everyone in this room to understand. And I think Andy alluded to it with a report that recently came out talking about the shortage of workforce. I think the report said around that Oregon is short 35,000 mental health and behavioral health workers. So I'm going to direct this to both Eric and Andy. Can you each comment on what that workforce shortage means and and help me understand how we can get towards solving that problem. Eric, let's start with you.
Wow. I mean, I'll do the what it means first. How you solve it, I'd be in Senator Wyden's spot if I could figure that out. But
Wait, is he here?
No, I appreciate everything.
he is.
We can't live without him. He makes this world a whole lot easier. But really, I think Laura's story talks about the impact of this workforce, right? I mean, she talked about very powerfully having an option, of incarceration or treatment. Because we have this workforce, there are a lot of people who don't have the option of treatment. It just does not exist. And we've also not wanted to put people in jail. So what we do is we leave them there, right? We put them on the street, whether they need to be or not, or leave them to their own devices without supports, without help. And then they get in this vicious cycle that even if they want to change their lives, even if they want to make a difference, they can't because they don't have the folks that can work with them and talk to them and understand them and get them where they need to be. So I think that's the biggest thing, is that we can identify all the people in the world through the data, through the engagement, through care management. But if there's no one to see them, or if it takes them months to get into treatment, then what's the point? They'll start to get discouraged. They'll say, you don't really care. Right? You aren't really trying. And that's the kind of thing we have to avoid, because folks really need hope more than anything else in this, to understand that they can change their life circumstance, but it's not possible all the time just by yourself. So how do you fix it? It's investing in a different kind of workforce, right? It's not building a workforce that's based on providing services like we had 15 years ago. It's identifying, hey, here are the disciplines we need moving forward. Here's where we need peer support for folks. Here's where we need health resilience specialists. Here's where we need community health workers, traditional health workers, so that folks can work at the top of their license on the real clinical issues. And because we're not gonna graduate a whole lot of psychiatrists and psychologists and MSs overnight. That's going to take some time, but let's get those folks at the ground level to be sort of that conduit, that contact, that support of folks at the front end, and I think that's the place to start.
Great. Andy, what are your thoughts on our workforce shortage?
Just building on what Eric said, and I completely agree with you, Eric, on all accounts. I'd like to say that the folks that choose to help, the folks that choose to do this work they're heroes. At the end of the day, they're heroes. And historically, the industry of healthcare delivery hasn't always valued folks, right? You combine that with a runaway cost of living through inflation and housing costs, and it's really hard for folks to choose to help in particular the public health space. So, wages are part of the solution, but we're going to need to get really creative with things like scholarships, things like direct student loan repayment, tax credits, rent subsidies, workforce housing. Those are some of those key solutions, because, gosh, I want to value any human being that wants to stand up and lean in to the human suffering of others. Those folks are gems, and they're hard to find. And when we look at the impact of the pandemic in particular, the pandemic got people into their computers, got people, many people with behavioral health background, hung a shingle on a computer and are now doing therapy sessions all day, every day out of their computer. And that's the opposite of what the folks that we serve need, right? Which is folks out in the community making connection, doing those types of outreach across all different types.
Yeah, thank you. Okay, well, I sense, and I have a clock that tells me that we're running out of time. So I am going to let Andy have the last minute. And Andy, tell us what's next for CCC.
Thanks, Juliana. First, thank you all so much for being here today. We are so grateful for your support and are just humbled to see this type of support here today. What's next for CCC is deeper collaborative partnership. Leadership through partnership. We're going to bring data sets forward. We're going to be asking difficult questions. We want to create a safe space for there to be discourse, disagreement, but most importantly, we're going to call forward transparency for the first time to say, how big is this issue and how far underbuilt are we? How big is this issue and how are we going to get folks sheltered and get folks indoors? And we're going to do that not just at CCC, but we're going to do that in collaborative partnership across the region and ideally across the state.
All right. Well, thank you, all of you panelists. This was so wonderful to be able to spend this time with you. And I really, really appreciate everybody's contribution today. So thank you, panelists. Let's give them a round of applause.